Okay, so good morning. Welcome. My name is Bleddyn Rees. I'm the chair of the Digital Health Society and the deputy chair of the ECHAlliance. We're delighted to see so many of you here this early on the opening day of health. I think it's appropriate to say that this is our third partner event with health, and we particularly owe thanks to Rich Scarfo, who has been a big supporter of ours over the years since they started health. The focus today is international opportunities and a little bit about the who and the what of the ECHAlliance. And a couple of things. So Rich recently sent an email to Brian and I saying that we have a tendency to misbehave to some of his staff. The strange thing is neither Brian or I drink. So this is a bit incongruous. How could we misbehave if we don't drink? So I decided that today I wouldn't wear a suit, wouldn't wear a jacket or a tie, and I would come in a soccer kit. So those of you who are observant will know that my name is Welsh, that this shirt is from a football club called Wrexham. Those of you who watched television in the United States may have seen the program about Wrexham, which is owned by one Ryan Reynolds and Rob McElhenney. So there is a connection, though, to what we do, because I have this wish to twin the Wrexham Children's Hospital with the Sick Kids Hospital in Toronto, which Ryan Reynolds gives a lot of money to and a lot of support to. So there is method to this particular madness of what I am wearing today. So that's who I am, and then I'm going to quickly go through some introductions about what we do. Ooh, sorry, wrong way. Let's go back. So the ECHAlliance does 4 things that we talk about. We connect people, we connect organizations. We convene meetings of people and organizations to bring about transformation of health and care services. We amplify messages from those organizations and companies, and we accelerate the deployment at scale of innovation. So that's a little bit very quickly about what we do. And this is the key to how we do it. So what you're seeing on that wheel is a representation of all the stakeholders involved in health and care that you need to transform health and care services. And we talk about those as communities, but the word that we use is they are ecosystems. And to make this real, we started with 4, and today, over 10 years later, we have 75 around the world. And what they do is these communities do stuff. They don't talk about doing stuff. And what we like to see them doing is to transform health by transferring best practice, lessons learned, and failure from one place to another overnight. So some examples of innovation that we get involved in. So the one sector that knows the most about remote monitoring of patients is not healthcare. Okay, it is maritime and energy. And energy companies own the most number of ships in the world. People have been getting ill on ships for centuries. So who knew the most about telecare at the beginning? Companies that own ships. In 2014, we took Shell to a Mobile World Congress to explain how they do what their service is. So we don't have time today because we need to go quickly. But you will see us around, and if you go to the exhibition floor and come to the village, we're there, and we can explain some of this innovation to you. Another innovation is Barcelona Football Club, and it's actually 9 professional sports, 2,000 professional athletes. But this, I'm putting this up because they have an innovation hub. They have their own accelerator, and that accelerator is really using the resources and skills they need to keep their players on the pitch uninjured. So the things that were keeping Messi from having a hamstring injury are some of the things that we talked about. And that's another one that we took to Barcelona. And then this one is a favorite of mine. So this is the Welsh Rugby Union. And this is what they have a lovely phrase, which is that they're in classrooms, but not in tracksuits. And what you have here is a digital curricula taken by another professional sport, taking the nutrition and their exercise understanding and skills and giving it to young children to increase their health literacy from a very early age. So really about prevention. And then a warning to those of you who are in tech, okay, about over-promising and under-delivering. So this slide is a favorite of mine. So it's from 1924 and the invention of the radio doctor, who was going to transform the delivery of healthcare. So the warning here is about how this works in practice. A little bit about data and health data. So the Digital Health Society is very focused on health data. And this is a diagram about the value chain of health data that we used for a hospital in the UK, and starting to understand and explain how you curate that data to create value. And then other things that we have done is very much about helping to plan for the delivery of the European health data space. And we ran a program of roundtables which came up with 7 key recommendations for the European Commission around the development of the European health data space. But for Europe, you can read pretty much any continent or any country looking at how you do some of this stuff. And that led to a series of reports from these roundtables that we published, and you can start to see what they are. So you can understand that we're actually quite a serious, and we have some serious capability around thought leadership. And then turning a little bit to the background to some of the European initiatives. So the European Commission cannot harmonize health laws, but it can harmonize digital laws in Europe, which creates this tension between where health goes as opposed to where digital health goes. And again, I don't have time, but here's the list of legislation that the EU is involved in that is regulating health. So if you have a business and you want to see trying to win business across Europe, you start to need to understand this backdrop of legislation. And again, by all means, come and talk to me in particular. So my background, by the way, is I am a health lawyer. So international healthcare is some of the things that I do. But then turning to the European health data space, just to give you a 20-second understanding of what it's about. So this is about researchers for secondary use being able to access health data in every member state for innovation. And also for primary care purposes, the ability for, if I move across borders, doctors in any of the member states would be able to access my medical records and find out anything that was relevant to whatever was happening to me at the time. So this is a very important piece of legislation, which at the moment is mired in some political controversy in Europe about whether it will be passed before the next European Parliament elections next year. And then we have the Artificial Intelligence Act, which again, in the last 6 months around the world has generated huge amounts of interest. And the EU is trying to pass the first ever piece of law on AI, including defining AI. And again, this is a really important activity for us in terms of pump priming, if you like, the innovation in digital health. So with that, I'm going to pass on and ask if my chairman, Brian O'Connor, will come up with his guest, and we're going to hear about the Voice of Africa. So thank you very much. We have the Voice of Africa in the audience. Would he stand up and come up? He was here, but Voice of Africa. The Voice of Africa is here. Please, grab us. First of all, Bleddyn, a couple of things that Bleddyn said, I just want to respond very quickly to. No? Come on, answer. Yep. Better?
Is that better? Yep. couple of things. First of all, Bleddyn is Welsh. I'm Irish. Those of you who follow the Rugby World Cup may know that we're now in the quarterfinals. I'm talking about the Irish, of course. Thank you. There's always one in the audience. And I'm looking forward to Wales continuing their successful run so far in the Rugby World Cup, but I'm also looking particularly forward to Ireland winning the Rugby World Cup. He also is a lawyer, so you have to be careful what you say. But some of the stuff that Bleddyn was showing is in the short time he had, is really of interest to many of you, I know. So we will make sure we share these slides with you. There's a huge amount of work going on in Europe and elsewhere. When we started the Alliance, I decided that I wanted to, at that time, make it a European thing only. COVID changed that, and we started to get requests from our partners around the world to be involved in some way, not so much in Europe, but just being connected, as Bleddyn was saying. That has now led to our global view of things. And it's epitomised this morning by sitting beside Phil. I call him Phil because I can't pronounce his surname. If any of you would like to have a go at it, you can do so. And basically we work together now because I've been in Africa a number of times over the last year. And in fact, we're both together again in Kigali in Rwanda next week for the Mobile World Congress there. And Phil will tell you more about what we're going to do there together. This will mean that Africa then is connected into our council and our global health connector, because we're great believers in, if you don't know what's going on in other parts of the world, you have an opinion, of course. Everybody has opinions. You usually mean they're wrong because they're ill-informed. And our job is to try to educate everyone and give you the opportunity of deciding if you really want to work with Africa and so on. So I'm hoping this morning in the few minutes we have to try to deal with some of the scale of Africa, the issues in Africa, and the opportunities in Africa. So I'm going to stop talking and I'm going to introduce my friend, and you'll be pleased to know, by the way, he looks very smart. The reason he looks very smart is his luggage arrived at 1 o'clock this morning, so he was able to dress in a suit this morning, to much to his surprise. So, Phil, over to you.
Thank you, Brian. Good morning, everyone. My name is Philbert Nsengimana. That's the tongue twister.
Okay, I'll get that a
minute. And that means I pray to God every morning. And Brian, you wanted me to talk about Africa, but let me talk just a little bit about myself so that I get to be introduced. I work as the Chief Digital Advisor at the Africa Centers for Disease Control. For those of you who know how this body operates in the US, it works exactly the same. This is an organization to promote and protect Africa's health security. But before that, I served in the government of Rwanda as Minister of Information and Communication Technology, and got an opportunity to start something that is like ECHAlliance, which is called Smart Africa, bringing all the African countries together to leverage technology to solve our socio-economic problems and be able to move a lot faster. So I'll say three things about Africa. And I've been in many conversations where I realized people really don't understand, unless you've been there and you've hung out sometime on the continent, you can really appreciate those three things. The first one is Africa is big. It's really big. It's very big because just geographically, it can contain China, India, United States of America, and the entire European Union. People don't realize because the map that we all look at is wrong. It's just based on some antiquated projection called Mercator projection. Perhaps I will have a time to show visually the continent is massive. So that's number one. Number two, Africa is uniting. There has been for many years a dream about United States of Africa. We are far from there. Right now we are 54 states, more than 2,500 languages. And part of this fragmentation is an effect of colonization, but Africa is overcoming that. So 3 years ago, something was launched called the Continental Free Trade Area that is transforming this 1.5 billion 0.4 billion market into one market, and that will be the single biggest free trade zone. Number 3, Africa is calling. Africa is open, is calling, is reaching out for partners, not aid, because that's another misconception about Africa, that we are here to be helped, to attract empathy or whatever. It's just wrong. Africa is strong, it stands on its 2 feet and wants business partners. The continent has massive amounts of natural resources. It has massive amounts of talent, and the middle class is growing. There is hugely and fast-growing class of consumers, and what Africa needs today is trading partners, respectful partnerships. Thank you.
The other thing I want to move on to then is, so what? What about the digital health aspects of all this? If you could take us through what we've been talking about recently on many phone calls, perhaps tell the audience where we are.
So each one of the 54 African countries has a digital health strategy, but I've been, over the last 18 months, working to bring all of that together, and now we have a continental digital health strategy. And I'll talk about maybe 4 major areas where we see opportunities, but also some challenges that we can use the Chinese word to...
Weijie.
Yeah, Weijie. So whatever challenge is also an opportunity. Number 1 is infrastructure. Just because of the scale of the continent and levels of incomes which are still low, there are many people who are excluded from access to health services. And telemedicine and digital health is the only solution if the continent has to reach the universal health coverage goals by SDGs by 2030. So, which means that we need to connect everyone. So the opportunity to build digital infrastructure that covers the whole continent is big. Right now, less than 50% of Africans are connected to internet. Slightly more than 60% have mobile phones in their hands. So I would say that we are working with all our friends and partners, private sector, governments, to make sure that no one is left behind when it comes to being connected. That's number 1. And connectivity means internet connectivity, having smart devices, having enough data storage on the continent, because we really care about data sovereignty, and and having the tools, the electronic medical records, the other platforms that are required to be connected. Number 2 is innovation. We believe that most of the solutions that are going to solve our problems in Africa need to be made in Africa. So far, we've really been consuming, but I feel there is a switch where Africa stops becoming, being a mere consumer of solutions and technology and start being a significant player in the production space. Number 3 is the issue of human capacity. While Africa has the talent that I talked about, we also have a big problem of brain drain. So we train doctors and nurses, engineers, and they come here. But we are not discouraged. We'll keep training them, because when they get here, they send money. So that's not bad. So we get a bit of the money and we train more. But we need to train when it comes to digital health. We need to be looking at, right from the top, the policymakers, the strategists, to the consumers, to have the digital literacy that is necessary to use technology. And that's number 3. And number 4 is the leadership, which is really important, which is why I'm here, to see how we can help connect dots and make things move faster.
Thanks very much. We're nearly out of time, but just to say that you can tell from that short intervention that Africa is, as they say, rising. There is no doubt from my conversations and discussions with people, they are determined to do things for Africa, in Africa. But the plea I always make to Phil and others is, don't forget about the rest of the world. Because when I see the frugal innovation that comes out of Africa, which is at a fraction, by the way, of what we in the West spend, there is a real market for export out of Africa, of ideas, of innovations, and we would hope someday to run trade missions from Africa to different parts of the world, including, by the way, next year when we have more than one voice of Africa with us here at Health. We have to finish there, but please join me in thanking Phil for his contribution. Thank you.
So thank you. If I can invite the next panelists to come and join me on stage, please. Come and take a seat. Each have a microphone. So, what we have now on stage are three members of the ECHAlliance. So I'm going to ask them each in turn to introduce themselves and give you a quick pen portrait of who they are, what they do.
Shall I start?
Please.
Can you hear me well? So, no? Is this one better?
Yeah.
Okay. So I was quite excited. On the pamphlet in front of you, for one night only, my name is Lisa Banks.
I know.
On there it's Lucy Banks, but I am Lisa Banks, and I am heading up digital health and innovation for GSK. We are here because our purpose is to unite science times tech times talent, and what a better place to do it than at Health. We are interested to learn from and listen to many of the different companies that are here to explore digital health and how we can collaborate together. I'm hoping to share today a few use cases about how we're employing digital health for our people, our pipeline and our processes, because tech powers everything that we do at GSK.
Yeah.
Good morning, everyone. My name is Pirkka Padmanabhan. I'm an associate partner at McKinsey. And for the last 5 years, I've been co-leading our health tech practice and domain within McKinsey, both in the US and in Germany. And so happy to talk to you today a little bit about what we're seeing in the market with regards to deployment of digital health use cases all across the value chain. I think it's an exciting time. In the last couple of years, we've seen a lot of the shift move from startup investors looking at this space to increasingly pharma looking at this space. So looking forward to the discussion with you all today.
And I'm Kathleen. I lead global healthcare market strategy for InterSystems, which is a Boston-based global company that deals in complex data management. And we've really been in the digital health space since its inception, since the company's inception, both. A high percentage of the work we do is in healthcare and working with digital health startups and innovators around the world.
Okay, so next I'm going to ask each of the three panelists to just give an opening statement. So they're going to speak for a couple of minutes. And then we're going to ask a couple of questions. And the intention is that I'm going to give the audience a chance to ask a few questions. So Lisa, yes?
Lisa or Lucy. So I wanted to be able to share some use cases about how we're deploying some examples of digital health within GSK. And it is it's a team sport. I always describe digital health as a team sport. The skill sets and the capabilities that we require in order to utilize and maximize the value out of digital health involves folks within our regulatory, clinical operations, legal, tech organization, as well as many different partnerships that really can help power some of those innovations. So one of the use cases I wanted to share that we're really starting to deploy artificial intelligence and natural language processing is in the identification of patients for clinical trials. There are traditionally very laborious ways in which we can search and identify patients that would benefit from partaking in a clinical trial. But deploying artificial intelligence, natural language processing, to a lot of these databases helps us to identify through the unstructured data patients that traditionally may not necessarily have been identified to be able to benefit from some of the trials that we're running. Not only is that identifying new patients, it's also accelerating the speed at which we can run our clinical trials. Because traditionally these processes have taken hundreds, if not thousands, of hours to do, and now we can do it in an hour and a half. So the identifying of more diverse populations, patients that probably traditionally may not have partaken in a clinical trial, is a really powerful way of being able to make these medicines more accessible. The second example I wanted to share was around accessibility as well, and I'm hoping we'll get a lot of discussion around hybrid and decentralized clinical trials as well. Not only from a sustainability factor, it reduces the number of clinic visits, but again, making sure that we can make healthcare more equitable and accessible. Not living next to a big teaching hospital will not necessarily mean that you are unable to partake within some research. And then the final example that I wanted to share as well was around digital biomarkers. We're seeing technology advance at an incredible speed to be able to identify novel sources of data, real-time data, that we can identify potentially even new targets, subsets of patients who are responding differently to their disease. And ultimately what we want to do within GSK is to get ahead of disease. And those digital biomarkers are helping us to identify at a much earlier stage potentially where you can make an intervention or indeed where you could even prevent the disease happening in the first place.
Great, thank you. Pirkka?
Super. I have two thoughts really when I think about digital health and pharma in the year 2013. So I think the first word is it's exciting. I don't think in the years that I've covered this space have I seen as much interest in the conversations across the industry when it comes to deploying digital health and AI and across the value chain. I think the second is value. And I think this is one of the big interesting areas for pharma to tackle this year. I think we've seen over the last couple of years, there are a lot of different initiatives going on in different pharma companies across the value chain, across geographies, but a lot of these tend to be pilots or individual domains that are being looked at. I think the key for this year will be to look at how do you actually quantify the impact of deploying such use cases enterprise-wide for pharmacos or even at TAs and certainly across countries. And I think this is one of the things that where we're having a lot of conversations on about which value drivers do you hit. Do you try to accelerate trials, for instance? Do you try to compliantly increase adherence to medication? Do you try to build solutions that are tailored towards HCPs? And I think the key here will be to always take a holistic view and also understand how that's generating value. Is it an individual revenue stream? There's a lot of excitement that we see around DIGAs in Germany, for instance, and how that could be a new revenue stream beyond the pill. Or is it something that really transforms the core and adds to the core a little bit to what Lisa was saying in terms of making your trials faster, getting therapies to market quicker, or of course also having an effect on the top line. And so I think that's going to be a key one to look at this year, just because I think this way the industry can really go and tap the full potential of all these technologies that are evolving at such a rapid speed.
Kathleen?
So I've spent my entire career working with secondary uses of healthcare data. How do we take the data that comes out of the process of care, out of the payment for care, out of all the things we do to deliver care, and make that useful to be better? In the old days, we did that with payment data, and we just looked at how do you streamline operations. What I'm really excited about is the kind of things that Lisa spoke about, those kinds of projects that are going to leverage that data that we generate as a byproduct of care and make it widely available. The challenge is that we have a whole lot of cultural and structural issues, and Bleddyn, you really picked up on some of those in the description of what's happening in Europe, but we have data privacy and security issues that make it very difficult to bring all that data together. We have data use agreements designed to ensure that we're not using data in ways that are inappropriate from the patient standpoint. We have interoperability issues. We have issues of proprietary views of data, and they all have kept us from sharing that information. Patients may be very willing to share their data for pure research, but they're not so willing to share it with for-profit companies who are going to develop products on that data. So I've been really excited to see projects like the ones you folks have talked about, but we've done some work with, for example, a large global biotech company that deals in rare diseases. And they took data from 50 academic medical centers. Basically, they allowed each of these centers to contribute all the care information for this patient population of interest It was aggregated, it was anonymized, and then it was made available back to those AMCs for research. And they've done hundreds and hundreds of studies using this combined data asset. One of the really great examples was during the early rollout of the COVID vaccines, when they were able to, in a matter of weeks, look at which vaccines were most effective for patients with this condition depending on the drug they were on, the treatment regimen. We couldn't have done that if we were doing a standard clinical trial, and it's the same kind of example you were just talking about. We have another group we work with where it's two hospitals literally across the street from one another who have many shared patients, but their own proprietary data assets. And they've created, or they're in the process of creating, a shared de-identified data set across all their patients to be able to better identify patients for clinical trials, tag those records for the IRB, be able to then make those available to researchers on a self-service basis, really speed up that process. The technology of doing the project has been trivial. We have that, that's easy. But getting through the agreements of the sharing between the two organizations has been the blocker. So it's not just technology, we have to get through the policy and business issues as well.
So thank you. So those of you who've been looking at the agenda for health, I hope will have seen that that this year in particular, we have more pharma companies attending, and for a number of years there's been tech companies. And the marketplace feels like collaboration has now become much more talked about. So the question that leaves me is, how do we ensure that there's more collaboration between tech companies and pharma, and how do we go about that? And there are two of you on the stage, and then there's an advisor in the middle. So what's your own personal take on how we facilitate transactions?
So when I started my career, I was a co-founder of a biotech company. So I've sat on one side, and I've now moved to the other. And I had a sojourn in between in public sector healthcare provision as well. But I would say there are really three principles about how the best partnerships work with pharma organizations. I think first of all would be the clarity of understanding the problem that we're trying to solve. I think there's a lot of, it's an overused phrase, but solutions, technologies looking for a problem to solve. But having a fundamental understanding of the problem, that company being really an expert in the problem, not an expert in the solution, an expert in understanding the problem to be able to really work together. Otherwise, these conversations tend to spiral. People speak to 1,000,001 different people in a very large organization. And it's a waste of time on both sides. So clarity on the problem that it's trying to solve and making sure it's a real strategic priority for the organization. The second one, and Kathleen touched upon it, is scalability. We are at GSK a global organization looking to positively impact the health of 2.5 billion patients. Now, I'm not saying that any startup company has to then service and help us with that ambition, but it's a global organization, and we have to work within many different healthcare systems. We have to work with it across many different geographies, compliant to different regulations as well, as you touched upon in your opening, Bleddyn. So thinking about how you scale, thinking about what does that look like and how you are going to be able to design a system that will be interoperable. And the last one, and I always save the last two the most important, if anybody takes away one thing from these, take away this one, and it's the trust. We are a 300-year-old company, and we have a heritage about trust when it comes to data and clinical information, and that's a non-negotiable. So when we think about data integrity, data safety, data security, the vigilance on that is something that we have to see mirrored in the partnerships that we make.
So I will say, I think Lisa almost covered everything I thought of in the beginning, but I think I'll just add to the point that you made around, create what's the value or the solution you're trying to solve, and it gets back to my value point I was making earlier. At the end of the day, I think it's important to say we're not just trying to solve this problem, but we're trying to, through however we're trying to solve it, try and create value in such and such way. Again, I go back to a little bit the value drivers I was mentioning earlier. I think in what I see a lot of people get excited about the tech, right? And there's clearly a lot of innovation happening here, but it's very important in those discussions to almost cut through the noise and say, what value are we trying to create? How does that add to what you're trying to solve here? And I think I can't underestimate how important that is in your conversations, and again, to cut through the noise.
Yeah, and I guess just to touch on one aspect of this whole topic would be, can we more effectively leverage the infrastructures we have in place for data sharing, and can we expand those infrastructures? So, you know, when GSK is putting on their infrastructure, and then Merck or AstraZeneca, they're each building that out. We also have, in many parts of the world, regional health networks that are already gathering massive data sets, tens of millions of patients, with data from across the health ecosystem, with claims data, with social care data, with clinical data, and they're bringing that together. Can we work to leverage those, harness those data assets that regions have been investing in, and that public health agencies need, not just pharma, and that carers need, and that digital health innovators need to be able to see the value of what they're doing? Can we harness those more effectively for research? HealthX in New York City, which has the shared records for about 20 million New Yorkers, has been working on making a version of their data set available in an anonymized form for researchers throughout New York to be able to access and leverage. It's not going to be perfect because it doesn't necessarily meet every use case you need, but rather than each of us trying to solve this, can we in fact leverage public assets for this?
So I think that earlier on we talked about the role of the ECHAlliance about connecting and convening. So you all have the chance to be able to listen a little bit about InterSystems Accelerator next, but also both GSK and InterSystems are here. So this is your chance, if you actually want to talk to them over the next few days, to actually initiate a conversation. And whilst the panelists may not thank me if there's big queues for them at some point, the reality is this sort of event gives the chance to be able to talk to people who are in a position to be able to forge those relationships. So please take advantage of that. So our last question before we run out of time, AI, because we were just talking about the vast amounts of data, and in such a short period of time, a little unfair question, but nevertheless, what's our view of AI in healthcare, opportunity or threat?
Shall I start and say both? I think used in a, look, this is a pivotal point. I mean, we're all going to kind of talk to our grandkids at the point at which, technology is moving today. But I do think that there is a degree of caution, a necessary caution, and at GSK we've set up our AI governance compliance board, which looks at across every aspect of technology that is deploying artificial intelligence to make sure that it is safe, it is compliant, it is transparent. But we see the advantages. It's a vigilant optimism that we're approaching artificial intelligence in, because we see the opportunity that it has, and it's just incredible.
Great, Lisa, thanks. Pirkka.
So I think from a pharma perspective, certainly an opportunity, and I think it's important to distinguish which AI are we actually talking about. Is it just traditional AI? Is it generative AI? Obviously generative AI is very much talk of the town these days, but I think if I look across R&D, commercial, et cetera, there's tremendous opportunity in both of those segments, right? Be it thinking about segmentation for, using traditional AIs or Gen AI in terms of redefining actual ways of working for all types of employees across the company. So I'm optimistic.
Kathleen.
I would share Lisa's comment that it's both, and I would say that it's a tremendous opportunity to look at how we take the busy work out of caregivers, take the cognitive overload out. But I would also comment that the biggest health problems we face around the world in every continent are those related to chronic disease and behavior-related conditions. And it doesn't matter how much AI I have and how much my watch is coaching me to do things, I, as an individual, have to choose not to eat that next cookie or make the decision to go out for a run. So.
Fantastic. Thank you all very much. And if we give them a round of applause, thank you. So if I can invite Andy and Dean Andrews to come up, please. Thank you.
Hey everybody, thank you for being here early on a Sunday morning. Very much appreciate it. I am Dean Andrews. I'm head of developer relations at InterSystems. I have a great job. It's a lot of fun. I get to work with startups and on innovation in healthcare. I'm not going to talk about my sports allegiances as some others did because it involves American football and I don't want to upset anybody. But InterSystems' perspective on startups is that it takes a global village to raise a startup. And we at InterSystems want to do our part. We also believe that much of the innovation in healthcare will actually come from startups engaging with other ecosystem players. So we try to provide all the support we can, and that involves our technology, our expertise in the company, and also all of our resources, marketing and other resources. So as Kathleen touched on in the last talk, we are a global company. We are headquartered in Boston, Massachusetts, but we do have offices all over the world. Over many decades, we have created the world's most popular health data platform. We have customers in over 80 countries. Over 1 billion patient records daily are managed on InterSystems technology, about 2/3 of the patient records in the United States. And we are known from the industry analyst perspective as world leaders in data management, data interoperability, and data analytics. We work with stakeholders across the healthcare industry, providers, insurers, life sciences, medical device companies, other software vendors, and then regional entities like health information exchanges and government programs like the Veterans Administration in the US and the National Health Service in the UK. So let me talk about our venture fund and our startup program. Here is the vision. We are accelerating startup innovation, and we do it at the very earliest stages from idea through incubation and acceleration all the way to market. On the idea stage, we have a global hackathon program, so we engage innovators when they're just building an idea, just forming a company. We connect with them and we help them along their route. And then we have our own incubator, which I'll talk about in a second, and we have startup accelerator partnerships with some well-known startup accelerators. And then we do leverage our place in the industry and conferences just like this, and we bring startups to conferences with us, and we have 8 startups with us in our booth here at Health. Just 2 quick examples to frame this. The winner of our challenge at the MIT Grand Hackathon last year is now in our startup incubator this year. And a graduate of our startup incubator last year now has an FDA-approved medical device. And we take them on the road with us to shows like Health. Instead of telling startups how we could empower them, we asked them. We had a lot of conversations, and we built our startup program based on their feedback. It has 3 pillars. It has incubation and acceleration. It has a corporate venture fund, and we have growth toolkits. This is a QR code for the landing page of our site where you can learn more details about it. Our startup incubator is a virtual incubator. It's in its 2nd year of operation. We have 22 startups from all over the world in it right now. It does have a physical presence in Prague in the Czech Republic, and that enables us to actually have hospital partners for pilots and sandboxing of the solutions. And we also have other partners like angel investors and others in the industry. And just a quick note about this, that because our technology is focused on data, that the use cases in healthcare are very broad. So we have startups working in AI and ML, diagnostics, genomics, and much more. We have self-service growth toolkits for startups in our program. This connects them to engineering support, additional learning opportunities, and then marketing campaigns, including we provide budgets for LinkedIn ads, AdWord ads, and webinars, where we blast startups' webinar information through our social media channels. And finally, our venture fund, we have 2 buckets of funds. We have grants that help startups just evaluate our data technology and complete a POC. And then we do have equity investments to empower startups to finish an MVP, reach their first or next customer. I want to just give 3 quick examples of startups in our program. We have over 35 startups in the program. We're growing every week. But these are 3 that are actually here with us at Health, and we have others at Health too. This is Morrow. They're working on mental health. They connect educators, parents, and clinicians to assess student mental health and then treat it if needed. This is Afia Record. They are from Africa. I believe they're here in the room with us, right over there. They are empowering patients in Africa to take ownership and control of their own patient health records and then share it across healthcare entities and stakeholders in their community and in their lives. And this is Modern Trials, and they are working both to get the right patients to specific clinical trials, but also make patients more aware and able to access clinical trials that might be helpful to them. We are at booth 4620, and please drop by and meet with us. We'd love to connect more and you know, be part of that global village that I mentioned. Thank you.
Thank you, Dean. Thank you, Dean. So, just by way of introduction, my name's Andy Bleaden. I don't sit down for 5 minutes, you probably guessed that. So now's the fun part of the show. I need you to let me know if you're from research or innovation organisations. Just put your hand in the air so I can get a picture of what we got here in the audience. Research, innovation, okay. And any of you access any research and innovation grants in the past? Hands up. Okay, well this session is about cash. My favourite topic, which is getting access to cash and using that network we talked about before, that Bleddyn referred to, that network of ecosystems. It's now getting up to 80, so we've just opened up in Ukraine. These are all got one thing in common, because they're a giant intelligence network, okay, that's useful if you're involved or would like to have access to one of 2 of the largest global programs on research and development. So we see ecosystems, as Bleddyn said earlier on, as permanent multi-stakeholder gatherings. So our membership is built up of one of the largest groups of universities and research organisations in the globe. Over 300 members of ECHAlliance have joined our network primarily because they want to collaborate together. So that's that part of that connecting the dots that we do amongst researchers and developers. That also involves working in programs that use and get involved with patient organisations, healthcare providers, payers, healthcare purchasers, etc. But what's also important in that network is that global network of ecosystems is, if you're involved with healthcare solutions, is a gigantic landing zone. So in every one of those countries, we've got connections, and that grows year on year. I was there in the first ECHAlliance. I joined because I wanted to buy stuff. So one of the interesting things about that network is that's ideal if you need permanent connections in any one of those countries. Whether it's in the far north of Finland, in Oulu, or down in our newest ecosystems in Zimbabwe, or away over into Sri Lanka or Australia. So one of the nice things about that ecosystem network is that provides us with those genuine contacts, warm contacts, to make those connections. So, let's talk about some cash. How many have heard of Horizon Europe program? This is big, okay? This is the world's largest research and development program. Just a small matter of 90 billion. What's up? Not turned on? It is now. So, my name's Andy Bleaden. I work for the... No, I'm only joking. So, one of the good things is you can't tell the difference. So, one of the things about this research and development program is 90 billion euros ensures immediate attention if you're a research and developer, or if you're looking to develop new solutions, because this is deliberately there. It's obviously in their interest because it's supposed to be able to promote Europe. But what's important, this is open for global collaboration. It's not just a European program. So this is a program that's there for US participation from Africa. So last week I was in Morocco talking about getting Moroccan and other African countries involved with that program, because they want to bring in the best of research with the aim of addressing problems in Europe. So we, as the Global Health Connector, are able to connect up you, if you're interested in these programs, with other organizations that lead these proposals. We also lead on these proposals ourselves. We use that network, as I said, as an intelligence network. So if you're interested in accessing that giant pot of cash, and I make no bones about it, it is the largest global pot of research, single point of research, come to us, because that's that benefit you get from being a member. So every month we send out funding and tender alerts for our members only, so you get a heads up on what new cash opportunities are there, but more importantly, who to speak to get access to them, whether it's the people up in Oulu in Finland, or the lead partner from France, or those research organizations you've not quite made those connections with. We have them. So use that global connector ability that we've got to access that network across Europe. So that's open for US, okay? Because of a deal that's been signed with the NIH, and I know we're hearing from them later on. But the other thing to bear in mind about that is that's also, going to press that one. That's also of interest for our ecosystem, because they need to make contacts and connections with you. Because very often they're looking to bring in partners from outside Europe to expand that knowledge pool, expand that user stakeholder abilities. That's why we want to partner with exciting organizations like Linkage Launch, based in the US, because we know we've got ready and willing participants within the US who want to take part. So again, some of these procedures can be a bit complex, and if I can be a bit blunt, they can be a bit boring. But what we can do, because we've got that expertise of putting these bids together and of assessing them, we can help you through some of these complexities, some of the practicalities, some of the hoops you need to go through to get to the access to that cash. What does that mean in practice? I used to work for the European Commission, so I've seen the answer sheet. I've scored them. I know what good looks like, and quite thankfully I've seen quite a lot of not very good ones. So I've got that ability to be able to spot decent proposals, and proposals that are exciting. So again, using that network we've got is a valuable tool, but also the expertise we've got in-house within the ECHAlliance as our Global Health Connector role. So join us. That's a quite quick call for action. So the other thing to bear in mind is we've also then got opportunities for non-US organizations the other way around, because there's obviously the US-based program, slightly smaller, but still very, very important for the areas it covers. And because of the agreements they've made with the European Union, that means that bilateral ability is there. So if you're actually a US researcher and you're struggling to find the opposite, i.e. participants and partners from Europe to take part in that, come to us, because we've got those connections, and those connections are strong. So just so we understand the details about that, those are 4 programs here that are actually been targeted by the US and the EU to collaborate and play nicely together. So if you're interested, come and speak to me after the show. Thank you very much.
Thank you. So moving us on very quickly, if I can introduce the next panel. So it's Jon Warner and Nicholl Althaus, who are both US ambassadors for the ECHAlliance. So we're going to talk to you about what we are trying to do in the US. Over to you.
Thank you, Bleaden. Welcome, everybody. To a degree, we're going to, Nicole on my right and I are going to split this presentation into 2 halves and just put a little bit more flesh on the bones of some things you've already heard about ECH, but in particular, what we're looking to do in a US context. Despite this accent, I live in California, have done for the last 20 years. So my focus is very much here in the US. Nicole's based in Minneapolis, also here in the US, and actually speaks with a proper American accent, so there you go. Let's go to the next slide, if we could. Have I got one up here? This one? Yeah, I can do it by myself. Thank you very much, team. One of the taglines you will see, and on our booth, we're at 3441 downstairs in the exhibition hall, and we have a whole village of people, including the speakers that you saw today. If you want to follow up and talk further to people, do so further during the exhibition. But you'll see the tagline is the Global Health Connector, and particularly for digital health, health tech, virtual care, whatever you like to call it. And I think this is where you need to think about our focus and our attention, particularly here in the US. So that's what we're going to be talking about. The problem we're solving, we think, and particularly from a US perspective, is that we're trying to, I think all of us, find best practice. So we don't have to start at 0. So what that means is that we sometimes have best practice and we can export that to others. And in other cases, there's best practice both elsewhere in the US and indeed around the world. Because we want to try and break down silos fundamentally. You heard a fair bit earlier on about all of that. By surfacing best practices, we can go further and faster. We can stand on the shoulders of giants and we can see a lot further in so doing. Because some of that best practice is buried and it's hidden. So one of the things that we do in terms of this global health connection process is to actually make sure that there's visibility in whatever area you might have best practice happening. And that could go across all of the areas that Andy talked about. So research is one of them. It's just knowledge in general. It could be around quality. It could be around standards. It could be around assessing digital health tech, for example. So this is the problem that we're solving for. We're trying to do this in a number of ways. And fundamentally, what we spend our time doing the most, and again, you've heard a bit of this, is connections, making connections. This room is a good example of individuals that you can meet very easily through being part of the Global Health Connector. So this is why we're advocating to join our organization, and we'll talk about that in a minute. Because many of the people in this room are expert leaders in and of themselves, or you might want access to them, and it goes well beyond this room. There are many people in the US alone. There's many people in many international countries. And of course, we can then curate that best practice, and we do our own job in terms of trying to do that curation. So we research, evaluate, score, try and make an assessment so that we can make that available in user-friendly ways to everybody. And then convene meetings so that people can talk and discuss how they're going to apply some of those best practice lessons. So we have many meetings that we talked about earlier on around the world in many, many ecosystems, and I'm going to touch on those in a second. So just in terms of numbers, Andy mentioned this a little bit, we're well over 1,000 organizations are part of the ECHAlliance Global Health Connector now. We've got well over 22,000 experts who are directly part of that organization. Our reach is into 78 countries now. That covers about 4.6 billion of the 8 billion on the planet. And we're helping them to get together and to go further and faster. That's fundamentally what the Global Health Connector is all about. And we talked about this earlier, but I just want to go to the chart you see on the right. We are all concerned, particularly in the realm of digital health, with a whole bunch of different issues. But affordability is a huge one, patient personalization, access to care, quality of healthcare delivery and outcomes, the opportunity for care collaboration, for example, some of the caregiver crisis we see both here in the US and elsewhere. These are all areas where best practice lives in many places and can be brought together and deployed in a holistic, value-driven kind of a way, which I think we're all looking for. So think of this organization as having the ability to pull those together quickly and effectively. And then lastly, and I'm going to hand over to Nicole, and I just want to go and reinforce what was said earlier in terms of this chart on the left and why it's got a multiplier effect. In the US, our goal is to pull together as many people to work with us as possible so that we get a rounded picture. So that whole chart, I think, is a very nice summary of all the different players that make healthcare what it is. We have a very complex healthcare sector here in the US. I've worked in the UK healthcare system. I've worked in the Australian healthcare system. This is a beast by comparison. So we have to work a little bit harder in terms of making those connections happen in order to create the multiplier effect. And that's both within our own country, but also in terms of how we might want to go beyond our borders, or indeed even access that best practice as it exists in overseas countries that we can bring here to the US. And with that, I'm going to hand it over to my colleague, Nicole.
I'll remember to, okay, you can hear me. All right, hi everybody. So I'm just gonna pick this up. We're not gonna go through this just because Andy did such a great job of that, but you can see the breadth of offerings and all the different people that you could collaborate across the globe. When I first came to ECHAlliance, I thought, oh, US healthcare is just so complex, and there's not a lot that we can learn outside. Well, was I wrong? Definitely wrong. There's a lot of great things that are going on in Africa for public health, getting access to care. There's a lot of great things going on in India and a lot of different areas that we can learn from, and we can create best practices that actually will fit the patient journeys that we serve. The benefits of joining here would be, obviously giving that increase to international markets, creating new friends, understanding opportunities and challenges that they face so that you can bypass that. I like that idea. Collaborate, scale up your innovation. If you've been a lot of folks here in the innovation areas, I've been a part of an innovation area. We tend to stick in our silos at times, but we research, we like to learn more. This is like your own little incubation lab. There's great funding opportunities so you can learn, not at your expense, but at the other, at the benefit of others. And then you can also, we really feel like best practices are a big thing that we could all benefit from here in the US in particular. If you've done or created any products or services along the line across the whole ecosystem, having best practices is really critical. Understanding that is something that I see a lot of value. There's a lot of great organizations to join today, and they give you a lot of opportunity to amplify your brand and understand. But I will say that the Global Health Connector really helps with that content and getting down to really finding out what is going on in healthcare and all the trends and how do you apply that. So one of the things that we also have, so we have ecosystems that are regionally specific, right? So we have a couple of ecosystems in the US, but we also have thematic innovation ecosystems, and I love these because they focus on a particular issue. Integrated care, cancer, mental health, digital health data, which we all know is really important right now. So these thematic innovation ecosystems, think of this, you could actually lead one of these as part of the research of your company or your organization. We just had I would say a session, what did we call that? A summit, thank you, at the United Nations. And we focused on 3 different areas. I'm a little handsy, sorry. So we focused on healthy aging, and such great data came out of this. I'm not gonna go through all these tidbits here, but oh my goodness, it was such a packed 2-day of the best content that I've seen in a long time. And that's because we have experts that we work with. We have experts that want to share their best practices and their experiences that are going to help us all. We also talked about green health and women's health, one of the biggest issues, I think, just maybe because I'm a woman, I don't know, but I think that there's a lot of opportunity to impact women's health, and we will be creating a thematic innovation ecosystem out of that real soon here. So basically, membership, we have different levels of membership opportunity. You can choose what you like. It's very affordable, which I think is great. It's a great way just to get connected right away. You can connect with innovators, you can connect with providers, payers, you name it, researchers. And it's a great way to learn more and be open to other things that are going on outside of the US. We also talked about funding before. I will just reiterate that what Andy said, definitely there's a great opportunity to work on the Horizon project. And also there are other funding opportunities with the NIH here in the States. I think it's the approval or I'm sorry. The proposals are due, they have already been due. I just flew in from Minneapolis, sorry about that. And anyway, the proposals are already due this year, but you can be thinking about next year. So that there's a great opportunity, and the fact that you can go with the EU approach on the project could really give you some opportunity to work with other leaders in the globe, around the globe that can help you. One thing just to note is we work with a lot of different folks here already in the US. We're looking to expand. You've heard from some of our members today, but we would love to put your name right on this slide next time. So, oh, you did put that in, okay. So these are the levels of membership. So we have individual, we have startup, we have growth organizations, mature organizations, and foundation organizations. And so which each level, there's different things that you can, that you have access to. Not only can you amplify your brand, you have access. We curate a lot of great content, a lot of great opportunities to improve your business and to improve outcomes. And so with that, I think I will leave it. Any questions?
That's great, thanks, Nicole.
No, okay.
Okay, thank you.
Thank you.
So the last presentation before we get to our Q&A is to give the stage to one of our partners. So this time it's to give you a chance to listen to a little bit about, should come up, Health Europe. Sam.
Good morning, everyone. My name is Sam Nicholl. I'm lucky enough to work with the team that's launching this incredible show into Europe. A year ago, Health Europe was 2 people, and we made a promise to our US colleagues that we would honour the enormous amount of work they do every year making this show what it is. And there's now 13 of us, and growing, delivering on that promise. So what is Health Europe? It's health. It's everything that makes health the exciting show that it is. It is quality content put on by our remarkable content team, who've already got confirmed speakers from Charité in Germany, Guy's and St Thomas's in the UK, and as of about 6:30 this morning, even Dutch royalty. It's also a show. We are uniting the entire ecosystem of European healthcare in one place, and we want them to have good memories. So we've got a human body shaped floor plan with a beating heart at the centre. We've got a patient art gallery to remind everybody at the start that that's why we do this. We also have industry night parties and beach parties and other Amsterdam fun. And who's it for? Europeans. It's a European show. We'd love to have some of the American audience over as well to learn. There will be a large amount of American tech influence, as you can imagine. And if you'd like to find out more, if you see me, come and chat to me, or anybody in a Health Europe blue t-shirt, or if you'd like a stroop waffle, come down to the sales office on the show floor. They are delicious. Thank you.
Typical of an Englishman to be bribing you with food. Okay, so we get to the questions section. Let's move through that. Oh, hang on. Okay. So a couple of things to say before I invite some questions from the audience. So we have at the village stage, which some of you on your tables, you'll see the leaflet, we have a whole load of pitching going on. So we have companies from the Startup Accelerator for InterSystems. We have all the booth holders who have stalls in the village pitching. And we have a variety of other companies that we've given opportunities to pitch to. So I'd welcome you to come to the little village stage and listen to some of that pitching. There's a prize here, so the winning pitch gets to go to the Mobile World Congress in Barcelona in February and have a stand there and get to meet some various companies. So a bit of a nice little surprise that GSMA offered. Here's where the village actually is located. So that's the aisle 3441. That's where the pitching will happen as well. So please do come along and meet the team. Okay. So I think with that, we're going to go to questions. So if anybody wants any questions of any people, put your hand up and we'll get a microphone to you. Hang on.
This time I will turn it on.
And while he's doing that, I'm just going to quickly make a few final announcements. So the slides from today will all be on our website. Also, this was recorded, so you'll be able to listen again if you want to. Please, if you want to connect with us, leave your business cards on the table. You'll see that some of our business cards are on the table, so please feel free to take those. If you want to come and visit us at the village, we would be delighted to meet you and talk further. And with that, yeah, so can you just give your name, where you're from, and what your question is?
Yes, I'm Lisa Rees, and I am from Minneapolis, St. Paul. Question for you on products and solutions that we have here in the United States that are getting adoption, they're gaining traction, getting access to the people that need them. How would a startup look at expanding into, say, Europe with a very different payer system? Obviously, a lot of different healthcare systems and how it works.
Look behind you.
So, the answer's simple. Do you remember the slide we had before with that ecosystem network? That's a landing zone. So in each of those countries, there are experts with national, regional knowledge and connections of what needs to be ticked, who to speak to in terms of adoption, regulations, etc. Those regulatory frameworks across Europe are obviously a little more unified, but not always. So use those as that intelligence network, that network of ecosystems, because they know best. Okay? That was easy. Any more questions?
Next question, and you can ask a question of any of the speakers, and we'll put a mic if they're still in the room, so don't be shy. This is your chance. Free advice. Have we stunned you into silence? You need coffees.
Hi, I'm Ken Rotundo. I'm a founder and president of a company you've never heard of. It's called Rehavior. We hyper-personalize patient communication. I was intrigued by the comment by the lady from GSK because she said that, we're oftentimes with innovation looking for a problem to solve. And there's no doubt with telehealth and data collection, we've gotten all kinds of data on patients, we've improved access, reduced friction, reduced geography down to a minimal problem, and all of these things are wonderful. But what I think I'd like this audience to know about is what about that moment in time when we interact with that patient one-on-one, and we treat them as a monolithic group, same size fits all. And so we've done some work in this area, and I'd be interested to see if anybody in the room agrees with me that this is a critical problem that needs to be corrected at scale. And just to put a footnote to this, our work has been done with the University of Pennsylvania where we doubled colorectal cancer screening in a Black community in inner city Philadelphia, and it's been published in JAMA. So those of you in the healthcare space where evidence base is important, JAMA is about as much evidence as any startup can provide. So if anybody wants any information about that, but most importantly, I'd like to know if anybody disagrees with the fact that it's critical that we improve at scale the ability to communicate one-on-one between a healthcare provider and the patient in that moment. Thank you.
I believe you have to switch them on, I've been told. I'm coming. There you go.
Thank you very much. Is that better?
Yeah.
So great comment, absolutely. And I do think that this is where we see digital health offering the reality of precision medicine. And precision medicine being bespoke to me. I am not a 70-kilogram male. And that's how clinical trials historically were designed. So understanding where we can use this technology to make sure that we are walking the talk when it comes to precision medicine is going to be critical. That's why, in terms of understanding some of the different nuances and the geographies and different cultures, when we apply a therapy, whether it's a vaccine or a medicine, is going to be so important. So at GSK, we've got a commitment to include diversity in all of our trials. The trials have to serve the populations that we're treating with those diseases. We've got colleagues from ViiV here today who are going to talk about some great case studies in HIV, but understanding particularly where that one-on-one connection is about how I live with my condition.
And just so you know, what we found in our study that we did with UPenn, which was really quite intriguing, is that we were able to give the healthcare provider a tool that in one group that we identified, it was the ability for that healthcare provider to say, do you want to dance with your granddaughter at her wedding? And this is not something that one would say to everyone, but if you can identify who you should say that to, and this is all based on Daniel Kahneman's work with behavioral economics and things like that, that people respond heuristically. And so while we're consumed with all the science, which is really great, at the end of the day, we need to apply that science in that moment in time. And the last thing I would point out, we found a group that in cancer screening, when they hear early detection, their subconscious has a strong temporal bias. And they say, I don't want to hear bad news right now. So these are things that we could apply, one-on-one. And I was intrigued that, in your comments that you recognize that this is an area that possibly should be explored.
I think the only thing I'm going to add to that is that I actually don't think it's a conversation just with patients, okay? It's a conversation with people, whether that's carers, whether it's family of somebody who is unwell, and also it's about the consumer world. So if we're going to drive prevention, we need to be having much better communication with the whole of society. So this whole thing about how we communicate about health, well-being is really important if we're going to have sustainable healthcare. Andy, there's a gentleman here.
It's very kind, thank you. My name's Hassan Chowdhury, and I'm from the International Journal of Digital Health. My question actually is for Sam on Health Europe. We've got so many shows now in Europe. He's left
the
someone
building.
else might have to answer from Health. But I'm really interested in what is it that is going to be different, because there's so many shows now. What's the standout? My first time at Health, So what's the health DNA? But perhaps because he's gone, it's not a right question.
So I think if Rich Scarfer was here, he'd talk about experience, and he'd talk about the number of organizations from different sectors that are here that you can have a conversation with. I think the $64,000 question for those of us from Europe is, what will it look like as a US show landing in a conservative European continent with very different cultures? And I don't know the answer to that, but the guys in the blue shirts, and I think they've got a booth as well, that's a really good question to ask them. So do we have any more questions before we go?
Just to add to that, if I might, one of the things you'll notice for the people who are new at health here is that idea of full-on content, morning till evening, networking full-on. And I think that's a concept that Europe has started to embrace a little bit more, because it's usually the idea we turn up, we go to the sessions, maybe go look around some booths, then we go home. The difference here is marked difference in terms of scale and connections. And that's what I've learned. So that's an example from my side.
So my final couple of comments. At Vive 6 months ago, one of the things that I got up and said was, I'm really interested in anybody who's got a product or service for menopause. You heard that in the United Nations General Assembly at the Science Summit, we were talking about women's health. In particular, we were talking about the fact that women are discriminated against in terms of the provision of health services. So I am carrying a candle for women's health. We had a great session at the UN. What I'd say is every man in here has an interest in this topic, okay? Every one of us has a mother or had a mother. Every one of us probably has a sister. Many of you will have daughters. We are inherently involved in this conversation. We have to stop standing on the sidelines and get stuck into the problem. So if you've got an interest in women's health, we are trying to create a thematic innovation ecosystem. So come and talk to any of the ECHAlliance people who have spoken today. One more question, sorry. Who's that from? Sorry, I can't see for looking.
Hi, sorry, I thought I'd sneak in just before we all leave the room. My name's Tom. I'm a family medicine physician and I'm also medical director at Orca Health. We deliver quality management systems to support the safe adoption of digital health, and I was really interested in the conversation around trust in digital health and best practice. And I just wanted to ask all of our speakers, how do we come together to reach a consensus around what good digital health looks like and what best practice actually is in this space? I'd be interested to hear people's thoughts.
Andy, you've got a...
Well, one of the easiest ways we find is to use our ecosystem network. Yeah? It's as simple as that. I mean,
that wasn't an invitation for you to answer, it was to give the microphone to
That's a great answer. That's a great answer. Can I just commend awesome about women's health as well? I think some of the statistics that you put up on that screen were just absolutely diabolical. So kudos. And yeah, we will definitely be talking about that. But to the trust component, I think, and this comes a little bit to the point I was making around scalability, and many of the different regulatory pathways that you'd put on there of the Data AI Act, European Health Data Space, we need to have a global consensus on what trust is. Otherwise, we're going to be reinventing for different geographies. It's never going to be able to take off. So some global standards around what trust is absolutely essential for globally this to move forward. But there's some core principles in it. And I think before I'd outlined those pieces of data integrity, cybersecurity. One of the most impressive things I ever saw, I think, and I've been with GSK for 4 years, was our CISO stood up on a stage at an event like this where we'd invited all of our partners to come and talk to us about partnerships. And he put his personal cell phone on the screen and said, if you are worried about cybersecurity, talk to me about it. Because that's the only way. We need educating from others. Others can learn from our experience as well. But this is something that if If we don't get it right, the whole thing's going to come crashing down like a house of cards, and the whole industry is going to be infected by it. So trust is absolutely paramount.
So I'll supplement that. So we put up earlier on the roundtable reports. There is a lot of detail about trust in the technology, whether that's compliance with things like GDPR, whether it's other forms of cybersecurity. But also, I'm going to be a bit controversial, okay? There also needs to be balance in this conversation. So about 14 years ago, I had a patient come to my office, and in an event that we were running as a firm, I talked about his medical condition. So he was the, I'm going to get this wrong, 9th person in the world to have a colon transplant, okay? And he published his entire medical record online. Why? The first 6 died. The next 2 wouldn't talk to him. He wanted to know, what's going to happen to me? What am I going to put up with? What's life going to be like? So he decided that he wanted to put the information out, okay? So he was giving up his confidentiality, and that's his right, okay? And we sometimes lose track of the fact that privacy and trust is the province of the worried well. When you're ill, you just need information that gets you a good night's sleep, less pain. And we must not stop that group of people who need to share information. The fact that the NHS and the Caldecott Guardian needs to have a principle that says share data tells you something about how the tail's wagging the dog. Because the information is key to improving outcomes for patients and their families. So we need a sensible balance around this. But it can be achieved. There's a lot of hard yards, but it's also about honesty. And the trouble with healthcare is it doesn't do honesty. It doesn't, governments pretend that you can have, as a citizen, you can have all the healthcare that you want. And it's simply not true. People die on waiting lists. In the Department of Health in the United Kingdom, waiting lists were referred to as demand management. So it's important to actually, yeah, okay, we've got enough time. So there's another gentleman. It's Kathleen. So I think there's a balance required. So Kathleen, sorry.
I would also comment in the interest of thinking about the broader health event. If you stay in this room, the next group that's in here running a partner program is the Digital Medicine Society, which is in fact trying to deal with that issue of how do we measure and document what is effective, and how do we make digital health work well. So this dialogue is going to continue throughout the event.
Brilliant segue. And with that, thank you all very much for coming. Really appreciate it.